All right. Well, welcome everybody to our webinar on New Access Points with Elizabeth Burrows. Thank you all for taking some time out of your day here to join us. We wanted to give everyone just an overview of what New Access Points are, who can apply, as well as looking forward to next steps as these are forecasted in 2024. So I'd like to introduce Elizabeth Burrows. Elizabeth is graduated magna cum laude from DePaul University with a degree in political science and communications, where she studied abroad at Oxford University. She went on to receive her Doctor of Jurisprudence from Indiana University Maurer School of Law. Elizabeth has worked at the Indiana State Department of Health as the director of the State Office of Rural Health, where she more than tripled the amount of federal funding for critical access hospitals. Elizabeth then returned to Cayuga, her hometown, to start up and serve as the founding chief executive officer of Valley Professionals Community Health Center, which grew over 1,000% in the 8 years she served as CEO. In 2014, Elizabeth started her own business, Burrows Consulting, where she has assisted numerous rural health clinics, federally qualified health centers, institutions of higher education, critical access hospitals, and other nonprofits obtain over $217 million in grant funding and over $300 million in enhanced Medicare and Medicaid reimbursement or 340B shared savings. She has worked with healthcare entities in over 35 states, and together with her team of 14, she generates over 6 figures per year while maintaining over 65% profitability. We're super excited to have her here today to talk about NAPS, so let's get started.
All right, well, thank you. For those of you that I don't know, it's nice to meet you, and feel free to reach out anytime. I look forward to connecting. For those of you that I do know, it's great to see some friends on, and I know we had a lot of people because this does conflict with a HRSA call today about the new bridge funding that we'll be recording this and getting it sent out as well. And you guys can also access that on our YouTube channel if you want to share it with others within your organization. So again, my company since 2014, we've brought in over $200 million. And I love telling my first grant story, which is I wrote my first grant at 19 to the Gates Foundation to bring internet into my rural community, and internet and computers to the local libraries in my rural community and my whole rural county, and was awarded that by the Gates Foundation. And I've been addicted ever since. And as I tell everyone too, I'm super passionate about healthcare. And I really believe that until everyone has access to Mayo Clinic quality care in their rural area, their urban area, but they're underserved and don't have insurance, until you have access to that kind of quality care here in America, I'm going to keep doing what I'm doing. And I always give the Mayo Clinic story because, again, they saved my life due to my personal battle with Crohn's disease, or as one doctor called it, crazy Crohn's. And again, Mayo Clinic helped me, and now I want everyone to have access to care. So I usually tell you I want my daughters here in rural Indiana to have that kind of care, and then I would no longer have to drive the 9 hours for all my checkups in Minnesota. So again, extremely passionate about grants and healthcare, and we're going to talk about new access points today. So again, just the clause, I have a consultant friend for rural health clinics, and he always does his crystal ball slides, which is we don't have a crystal ball. So again, any information I'm sharing with you today was based on the 2019 New Access Point NOFO, or Notice of Funding Opportunity. Information we're sharing is based on the forecasted New Access Point grant that is currently on grants.gov, and any information that we have found on that. Also, Jim McCrae has shared information. We've gathered that and his funding slides as well. So again, and we're also sharing our experience. I have been a part of every NAP grant cycle since 2007 and had success in those cycles. So that's what we're talking about today. But again, anything could change and is still changing because, again, we're dealing with federal governments and grants, and most of you probably have experience with that and know that that could change at any time. So there's our clause for the day. And for the recording, we are recording this September 20th of 2023, and we recognize that things after that date may change. So thank you. Again, previous success. People always want to know, have you had success? I can tell you that I have had successful grants in every round since 2007. And that's when my original Health Center Valley Professionals Community Health Center based in Clinton, Indiana, was funded during that round. We were funded in 2007 and opened our doors in 2008. Since then, I have written either for my health center or for clients every single NAP cycle, and we have had success in every single NAP cycle. Has every grant we've written been successful? No, I wish that, but I don't think there's any grant writer out there that can say that. But I can say that we have been successful in every single cycle. I can also tell you that it will be extremely competitive. The last 2 cycles did not have very many awards. And there was like 75 given last cycle, with about 10% of those going to Puerto Rico following the hurricane. This cycle, there is projected to be over 200 awards, which is more than the past 2 cycles combined. So that does help people and should give you hope. And there are around 130 FQHC lookalikes that I hope are applying, because if I were a lookalike, I would definitely be applying. But again, this is open to anyone. And this is a great year because there's projected to be about 230 awards. And again, this is more than has been given out in the last 8 to 10 years total. So this should be a good time for you. So just to go over, and some of you may say, I already know this, but what is a NAP, a new access point? And just for clarification, a lot of people say, well, I'm an FQHC lookalike, I already have a site. I'm a rural health clinic, I already have a site. That's not a new access point. If you are not currently an H80 funded site within a current FQHC health center scope, you are a new access point. So in other words, if that exact address with the 9-digit zip code and the exact address with the suite number or the exact apartment number, whatever those details are, is not on a Form 5B for a current H80 funded grantee, you are eligible for a new access point. So that includes rural health clinics, hospital-based clinics, independent clinics, any clinic. And you don't even have to have an open clinic. You can say, if you give me a grant, I can have a clinic open in 120 days. And all of those count as new access points. Also, current H80 grantees can apply for new access points. That's not a problem. It just has to be something that is not currently in their scope, or again, listed on their Form 5B. Again, there was a cycle in March of 2019. At that point, 77 new access points were awarded. And I believe, from what I have been told by NAP reviewers, it was about 1 in 12 is what got funded. Again, we are looking that they are projected for $150 million in President Biden's budget for NAPs, with about 230 awards. As we know, because we probably all watch the news or see the news on our phones or tablets, we all know that this could in fact change based on budgets. But again, right now, this looks to be in the president's budget and the House budget. So it looks extremely likely. And it's also on the grants.gov forecasted list. Usually once it makes it on the official grants.gov forecast, they do come out. But again, as we know with funding sources, everything can change on a moment's notice. Right now, they are set to be released around December 12th and due around February 12th. If you're one of my clients, you already know the story I'm going to tell, and that is no babies ever come on their due date. Mine did not come on their due date, and most grants do not come on their due date. But again, that is the approximate amount of time. By law, HRSA has to give you 30 days when they announce a grant. And typically they give around 90 days, but they do not have to. So somewhere between 30 and 90 days from when they are announced to when they are due. That includes weekends, federal holidays, your own vacations, days your clinic's closed, whatever days that includes. It is 30 days date to date. So again, it's estimated in December, announced, and it will be due exactly 6 days later is the way it's announced right now. Again, everything can change, but those are projections. And again, trust me, if you think time goes fast now, time speeds up from the day they announce a new access point. It will be moving extremely fast to get all the pieces pulled together for your application. So if you are not preparing now, you better get started. And the fact that you're on this webinar shows to me you're preparing and you're getting ready, which is great. Just to reemphasize, who can apply? Public or nonprofit private entities, including tribal, faith-based, and community-based organizations. That is straight from the last NOFO. We do not expect that to change. You can be a new organization that is not within the FQHC program or an existing health center program. A new applicant is someone including FQHC lookalikes who are not getting health center funding. Satellite applicants are those that are current FQHCs that want to open a new location. And again, it has to be a new service delivery site. It cannot be something already within their scope. Now, if you're already serving patients there, but it's not on your Form 5B, you're not billing it as an FQHC, then that could count. And again, you could have open clinics, you don't have to, but you do have to be ready to implement what you say you're going to implement in the grant within 120 days of grant award. Okay. So priority areas, and this is where it gets extremely complicated. There are 4 types of health centers, and that is by law. When FQHCs were created under President Johnson, they set up 4 target populations. Most FQHCs that you're familiar with are community health centers or CHCs, and they just work with underserved individuals. Now, does that mean they don't serve insured? Does that mean they don't serve rich people? No, they can serve anyone, but they are set up to be the safety net provider, and they must take Medicaid and Medicare. They also have migrant health centers, which again serve migratory and seasonal agricultural workers, healthcare for the homeless, for individuals experiencing homelessness or are at risk for experiencing homelessness. And that difference is very important because HRSA's definition of homelessness is not always what we think of. So their definition of homelessness includes doubling up. In other words, 2 families within one location, more than 2 generations in one household. People at risk. In other words, they are close to living at the poverty level and being kicked out of their homes. So again, and also, couch surfing, any of those people that do not have stable permanent housing. And then public housing primary care, which is residents of public housing. What that means is, and I don't know the exact divisions or percentages, but what that means is that funding that they have set aside, which right now we believe to be 150 million, has to be divided each of those categories. So there will be public housing recipients, healthcare for the homeless, migrant health centers, and community health centers. Also, FQHCs can be a combination. We have FQHCs that are up to 3 of these categories that we work with regularly. And many of our FQHCs are 2 categories. So they may be a community health center and also a healthcare for the homeless location. Please keep in mind, healthcare for the homeless are required to provide substance use disorder services. Bonus points can be given for a high unmet need score. These are based on the 2019 NOFO, and that could change. A sparsely populated area and a lookalike. We do expect bonus points to be given to a lookalike because that was done in 2019 and also in the previous cycle of 2014, I believe. So 10 points were given in 2019 and 5 points were given the previous cycle. And everyone I have talked to, connections that where I've got friends in high places. I also have friends in low places, but in this case, we're talking about friends in high places that work with HRSA regularly. They said there will be bonus points given for lookalikes, and I do expect that to be true. The other things we don't know, and unmet need scores are still being updated. So again, if you go to the HRSA.gov website, you can look and reference that information. Next. So the requirements of a new access point, that you have to provide comprehensive primary medical care as the main purpose. So you can't single out a single health issue. So you can't be a specialty care clinic. You need to be providing primary care. And again, primary care is all inclusive, including pediatrics, geriatrics, internal medicine, etc. You have to ensure that required primary healthcare services will be available and accessible in the area with at least 40 hours per week and 1 permanent site. Again, this is based on 2019. This is one that we have seen a change. And there has been a little guidance came out that said that you could do a mobile clinic. In 2019, we didn't think so. This year, we think you will be able to do a mobile clinic. Whether they're requiring you to have one permanent site remains yet to be seen. So we're watching for that. But mobile clinics do qualify. Excuse me. You have to propose service delivery sites located in an area with a shortage of health services. And again, based on 2019 requirements, you cannot be in the same building as a site already in the scope of a Project Health Center award recipient if you're putting a new access point there. Now, for lookalikes, yes, you can apply for your current sites. You must propose to serve a medically underserved area or medically underserved population. And if you want to check that, go to your Google, type MUA find, MUP find, and put in your address, and it will explain that to you. Also on required services, that's also on the HRSA webpage or HRSA webpage on Form 5A, or you can email us and Hannah can send that out. We'll try to put the Form 5A with our presentation so you can see those required services when we send that out. Okay. Now, these are your applicant components. So I've already made your grant checklist for you in your outline. You're welcome. Okay. So here you go. If I were you guys, definitely print this when you get going on it. This is the narrative sections that you have to have, your attachments and your forms. And again, you cannot exceed 175 pages. That was the same in the past 2 cycles. Will that change? I doubt it, but you never know. And again, these are the sections. Nothing is surprising here. If you are a current FQHC or a lookalike, this should look extremely familiar. If not, again, really, they are exactly as they explain. You have to do a needs assessment of your service area, a response. How are you going to, all these needs that you say you have, how are you going to address these needs? If your county has extremely high rates of smoking, then your response should have something responding to smoking cessation. If your area has extremely high rates of diabetics, or your service area does, you may need to make sure in that response that you're addressing that diabetes crisis that you have, HIV, or whatever it is that's in that needs. Collaboration are working with those partners, those health departments, hospitals, RHCs, FQHCs in your area, and getting letters of support from them. And in the past, those letters have had to be dated in the times that the grant is open. So if you think you're getting ahead, one thing not to get ahead on is letters of support. Evaluative measures, how you're going to show your impact, your resources and capabilities. This is your chance to brag on yourself. Your governance, because again, why are FQHCs continually supported by Republicans and Democrats in Congress and the presidential level? And that is because of the governance factor of the board and support requested, which includes a narrative, your budget, and your budget narrative. The attachments are pretty self-explanatory, but again, you'll want to make sure your sliding fee discount schedule is set up according to the federal poverty guidelines that are most recently out. So if I were submitting this today, my sliding fee discount schedule would be based on the federal poverty guidelines that came out in January of 2023. So always check that. I will tell you, it's very common for FQHCs that have been in existence a long time to be working off of the wrong federal poverty guidelines. So if that's something you take away, go check that. And again, most of this stuff is self-explanatory. You should have a space secured, but that may not be required. I know I was actually funded a NAP cycle 3 years ago, and we did have floor plans because we had a proposed building, actually a modular clinic that was going to be built. We ended up changing our minds and doing a stick-built building, and the floor plans were different. HRSA did not get upset with us. They let us submit the new floor plans, and that clinic still exists today, was fully funded for a new access point. And then you have your forms. Again, most of you, this makes perfect sense. These are forms that you are used to. Keep in mind the clinical and financial performance measures are based on the UDS report or Uniform Data System report. If you are not familiar with that, HRSA does have some upcoming webinars, and I encourage you to look that up on the HRSA website. And then the application review process. So if you have never signed up to be a HRSA grant reviewer, I encourage you to do so. It is a very informative and worthwhile experience. It's also a lot of work because you have to read how many applications at 175 pages each, plus the forms, but it is very informative. Grant reviewers are selected on expertise, knowledge, diversity, and that they don't have a conflict of interest. I do HRSA grant reviews, but again, I've never done a new access point grant review. And that is because I have always written, ever since I knew about FQHCs, I've always written for a grant in every single cycle. So I am not able to review those. But again, they are people like me and like you who work in healthcare, have some kind of knowledge of it and care, and are willing to kind of donate time or be paid minimally for time to review grants. There are currently about 9,000 individuals who have actively served on a HRSA Objective Review Committee. And I did just talk to someone who's at a national meeting with the Federal Office of Rural Health Policy, Tom Morris, who oversees that, and he was actively recruiting HRSA reviewers yesterday. He said how bad they need them to go to the HRSA website, to email people at HRSA and let them know if you're willing to do that. Clearly, if you guys are interested in going after those, does not make sense for you to do that, but it is something you may want to do for other grants. The reviewers meet virtually, and you independently review and score the applications, and then you convene as a panel to discuss. And I will tell you, on average, you spend about 2 hours per application. Someone presents the application, the other 4 or 5 talk about it. They try to have diversity in every way: geographic diversity, racial diversity, gender diversity, experience diversity. And then they always make sure there are experienced grant reviewers and usually at least one new grant reviewer. So again, this is not going to be reviewed by feds. This is reviewed by citizens just like us, again, who are willing to dial in and sit for 8 hours in front of a computer with your screen on, your camera on the entire time, talking about these grants. And then after you meet as a panel, you give the final score. So you redo your score after you've talked about each application. And then as a group, you don't know what the exact score is that application gets, because they then average and tally up those scores. Criteria may be identified as strength, met, or weakness. Make sure you're watching just meeting criteria. You always want everything to be a strength. I will tell you, you will get feedback after your application, and make sure to pay attention to that, because HRSA people have always told me it takes on average 3 or 4 times when you apply for a NAP to get funded. I have been way luckier than that and gotten them the first times, but the same sites, they say, usually have to apply at least 3 times. So again, you'll want to take any of the advice you get and look at that. If you applied in a previous cycle and did not get funded, or your company did, or your organization, pull out that review. I mean, even if we're going to write the grant for you or another grant writer is going to write it, that information is helpful. So definitely look at that. Look at the reviews that you have received in the past. And if you say, well, I haven't went for a NAP, but maybe you went for a Ryan White grant or an R-Corp grant or some other HRSA grant or SAMHSA grant or another federal grant, look at the reviews and see what information you can pick up on. Again, you have 120 days to have your whole plan operational. You have to have unduplicated patient projections for the next calendar year and then beyond that. And then in looking at the information provided by HRSA, common reasons for an ineligible application, which means they don't even make it to the Objective Review Committee. And trust me, you definitely don't want to put in this much work and not even have your application reviewed, is that you're over 175 pages, you're missing part of the application. Your proposed site is located at the same address as a current health center award recipient, or you're applying on behalf of another organization. You have to apply for yourself and have that organization set up. Again, even as a public entity model, you can get grants, but you're still applying on behalf of that organization. If you have any questions about that, feel free to reach out to us, Hannah, or I would love to assist you. So looking ahead, we know it's going to be competitive. This is the first time we've had a funding since in 4 years, so be ready. There's going to be a lot of applicants ready. And everybody wants the money. We all want $650,000 per year in perpetuity for operational costs, or $1 million per year for 2 or more sites. So we all want that money. I'm guessing those are the same amounts. Those were the 2019 amounts. From the previous cycle before 2019, it went from 600 to 650. And again, those are once you get a new access point, it does roll into your service area competition grant. And as long as you are in good standing with her, so you will continue to receive that funding forever. So this is very important. You want to do the right job now because it will pay off. You want to start thinking about your service area, your applications, getting all of your documents in a row, your financial statements, your audit, your evidence of nonprofit status, making sure you're in good standing with nonprofit status. Have you checked your own state Secretary of State website to make sure you're in good standing? If not, and you're missing one document or something, that could throw you out. So you want to make sure everything's in good standing. You want to check who in your organization has the logins or authority for grants.gov and HRSA electronic handbook, or as we call it, the EHB. You do not know. There is probably not a month goes by that we don't have an organization try to apply for a grant in grants.gov and that the person who has the authority left the organization, retired, no longer works there, has forgotten their password, changed emails, or otherwise. So make sure you know that you have the authority to do this because it can take weeks even to get this type of thing resolved. If for some reason the only person that had authority no longer works there, you have to send in a notarized letter. It's a whole process. It takes so many weeks to get that changed. So I cannot emphasize this enough. Make sure your UEI, unique entity identifier, which used to be a DUNS number, is up to date, and your SAM.gov is up to date. This can take up to 6 weeks. So again, you want to have these things done before the NAPs are ever announced. And keep in mind, it may take, again, 4 or 5 years before new access points come out again, maybe more, maybe less, but you want to be prepared now and not miss this cycle. So be ready. And then just some tips that I've learned from doing this so many years and so many cycles, and also in my company as we're constantly writing grants for our healthcare clients. You want to have a proofreader early in the process. Set your deadline. You really should submit the grant 4 days before it's due because there are computer glitches. There are system maintenance errors. There is, oh no, the password expired. I got to re-enroll. All those things that can happen and go wrong will. And you can't be waiting till the last minute to submit because everybody else does that. And it has happened to me where you jam the system. Make a list of items you need from others within your organization and also the community. Who keeps the nonprofit status at your organization? Who has all the financial statements? Who knows all the partners and the letters of support you're going to get? Who's going to request those? And so on. Review the already written stories you have about your clinic, your health center. Have you written grants? Do you have marketing material? Start working on your written story and review what you have. Write your story into the questions, start working on it, divide up tasks, and honestly, you should be writing this as soon as you can. I know we all have 100 things to do, but also researching the needs assessment information and things are things that you can get going right away. And then again, make sure you have an outline of the NOFO or the Notice of Funding Opportunity, have others help you. You need facts about your clinic and the patients you serve, and you also need stories, and you also need people that support you. Make sure you address every line, every question, and every attachment. And I know you're like, oh, great, I'm having to hear from a grant professional to tell me that. Of course, people do that. I have heard over and over HRSA talk about the number of grants that do not even get reviewed because people do not address those things. And then make sure you listen to any grant calls or you review the online FAQs. I'll be honest, oftentimes the grant calls stress me out hearing people start with their what ifs. So I prefer to always review the online frequently asked questions, but you want to make sure that you are checking one of those because sometimes they do in fact change grant requirements and they do not necessarily tell you. You have to be checking that and knowing that. So again, some final thoughts. We've all heard the saying, failing to plan is planning to fail, but I will tell you that is for sure in this new access point. If you aren't already thinking, planning, knowing what you're going to do, you're behind the 8 ball. So make sure you are getting started. I can tell you the last 2 cycles that have happened since I've had my business, the day new access point grants come out, my phone literally rings off the hook for about 72 hours. It is insane. And the emails are insane because all of a sudden people see it's out. Can you help us? We don't know what to do. Can you help us write this grant? And I will tell you, really, you need to get started immediately. Start thinking who you want with letters of support and making friends with those people. Look at clinic locations. And then do you have leases? Do you own those facilities? How can you get the location? What all will this take? And making sure that you get board approval to submit the grant. That may be a final thought for you, but HRSA will check that. That is a requirement of FQHCs, is that HRSA makes the actual governing board of the health center approve the grant. And again, all this is in 30 to 90 days. So get your roller skates on and be ready, because there's a lot to do in a short amount of time. If you have questions, I would love to work with you, assist on this, or let us know how we can help. We'll also be opening it up to questions. So if you have questions, put those in the chat and Hannah will be asking those of me, or you can unmute your line and ask us right now. Again, or you can text me, email me. As I always say, if I don't get back to you in 48 hours, bug me again. Sometimes we have spam filters or things that I miss that, but we would love to work with you on this. And again, we want to bring as much money as we can for federally qualified health centers. And we want to spend all that money. Just a quick story. One of the in recent grant, there was one just on ending the HIV epidemic, and actually HRSA awarded more to every fundable application than was expected because they did not have enough high quality applications. So everyone got, I can't remember, around $25,000 to $45,000 more than they requested, which is great for our clients. Nobody's happier than when they apply for a grant and they get more than they request. But we definitely do not want that to happen here. We want to make sure there's plenty of quality applications so everyone for these underserved communities can get the money that they need. And yes, it looks like you've raised your hand, Mr. Chalwa. So
Hi.
I may mispronounce that. I'm sorry.
Thank you for letting me ask my question. My name is Dr. Chawla, and I'm going to give you just 2-minute info as to what's going on with us. And so our hospital, Martin General Hospital, closed on August 3rd. We are in Williamston, North Carolina. It's a Tier 1 county. Predominant payer mix of Medicaid and Medicare patients. That constitutes around 90% of our population. Now we are trying to set up a clinic and then eventually transition into an RHC or an FQHC. My question to you is, they have an existing FQHC in the town. The people are not happy with it. We have patients coming in from there trying to see if we can be their primary care physician. So can the same town have 2 FQHCs?
Yes. And I have seen it over and over. It happens in big cities. We've got an FQHC funded, and out of the 4 corners at a stoplight, 3 of them were different FQHCs, and the other one was a pharmacy. And we got one funded there. In a rural county here in Indiana, they said, there's no way you'll get a 3rd FQHC. We got a 3rd FQHC funded. It is based on the UDS mapper and penetration rates. And I think Hannah has your contact information, so we'll definitely set up an individual call with you so that we can analyze that data and make sure that there is a need and that one is available. So keep up the great work. If patients want to come to you, patients vote with their feet, right? So that's good. Okay, Hannah, do we have some other questions?
Yes, we do have some other questions. So first one coming in is, we are a lookalike that has been open since 2016. Since we are not an H80 funded health center, does our main site count as a NAP site? We would not need to open a second site, correct?
Right. So as a lookalike, and that you are not a current H80 funded grantee, you would be applying for the sites currently in your lookalike scope. So whatever is on your Form 5B, whatever locations, those would be your sites. And no, you would not have to have any new sites. You can just apply with your current sites and services that you are providing. That is something you may want to consider if you want to strengthen your application, especially with the focus on behavioral health. I'm not for sure if you're providing that. If not, it may be something you want to consider providing behavioral health or expanding. But again, that's something you can look at in your planning efforts, but you do not have to do anything new as an FQHC lookalike. If you are a fully funded H80 grantee, you have to have a new site that is not currently in your scope. And we'd be glad to follow up too with an individual meeting if you want to talk and plan that. Just let us know.
Absolutely. And just to, before I keep going on to questions, there's some more, but Elizabeth's contact information as well as our website are on there. So if you do want an individual meeting to chat more, feel free to reach out either to myself, I'm the one that's been sending you emails, or Elizabeth, and we'll go ahead and get a meeting set up. But next question is, what time frame should the organization be a lookalike prior to the NAP application?
There is actually no amount of time. So you don't even have to be a lookalike and you can apply, or if you are a lookalike, you would get the bonus points. Based on the last time they did this in 2019, if you were a lookalike and designated before the time of the funding, which means not when you applied, so you wouldn't have to be a lookalike then, but that you were in fact a lookalike before they award these, which we expect to award them about a year from now, around Labor Day 2024, if things go as planned. They never do, but ideally, you would get those bonus points if you are in fact a lookalike by that time. Now, can HRSA change those rules? Of course, but that is what we are expecting. Yes,
and Christy, I believe you have a follow-up question to that as who asked the original question.
So we are applying for lookalike right now, and
yes.
if we are awarded, for example, like one day before the lookalike or before the NAP, the full applications, would that count and give us point?
Yes. In fact, if you were awarded, again, as long as you're awarded by, say, August of 2024, it would give you the awards. As long as you're designated a lookalike before the new access point awards come out, because what happens is this independent review committee does all the scoring, and then HRSA comes back in and adds in the bonus points. At least that's what we're expecting. Now, again, they can change the rules, but that is how it's been in every cycle that I've been a part of since 2007. They've added those points at the end for the lookalikes.
Okay, that's helpful. Thank you.
Mm-hmm. So if you are considering lookalike and NAP, that should just add fuel to your fire to get moving on lookalike. Because again, I will tell you that, as we all know, we've all taken tests or exams. Out of 100 points, 5 or 10 bonus points is usually the difference between being funded or not funded. So you want to make sure that you are getting those bonus points, because that's huge. And again, it was 10 points under President Trump's cycle of NAPs and 5 bonus points under President Obama's cycle. So I've talked to people, both sides of HRSA, and somebody said, well, it's going to be like Obama's cycle. And then I had some of them say it's going to be like the last cycle. Again, that's where I do not have my crystal ball. You are exactly right though, Christy. You want the bonus points, because again, we all know even 5 points out of 100 is huge. So.
Perfect. Thank you. That answers my question too. We had one question come in on how many bonus points lookalikes get. So that answers that question. 2 more questions that came through, but again, if you have more, please put them in the chat. First one is, can I apply as a RHC?
Yes, you can apply as a rural health clinic. And honestly, that puts you ahead of the game because you have most policies and procedures in place. It also, this is years down the road, once you're funded and once you're set up, and you have been designated as an FQHC, when you switch that at the CMS level, it speeds up your credentialing process and your payment processes, which I know this webinar is not about that, but you will appreciate it later. And yes, it will be a selling point of your application to let them know that you are a rural health clinic. In the past cycles, it has not been bonus points, but again, that's definitely, if I were writing your application, I would definitely emphasize that you are a rural health clinic and you've went through all that accreditation process, and that puts you ahead knowing, hey, you're already serving patients, you're already serving underserved, you probably already have a sliding fee scale in place, so that's going to put you ahead of the game. Keep in mind if you, that hospitals cannot own FQHCs. So if you are a hospital-owned provider-based rural health clinic, you would have to make sure you were an independent rural health clinic, or that you set up a separate nonprofit status for that, because hospitals cannot apply for FQHCs unless there are certain exceptions to the rule. And if you want to go through those with me, we can set up a separate meeting. Just reach out.
Perfect. And then last question that I had was, can an organization submit more than one application?
In the past, no. Every tax ID was required to submit separate applications, and you could only submit one. Your application can, however, have multiple sites, and that's where you can, instead of requesting $650,000, request and be awarded $1 million for having multiple sites. But you, in the past, no, you had to have separate. Only every UEI, unique entity identifier, or DUNS is only able to apply for one, is how it has been, and I would expect that not to change.
Thank you. We will, again, if there's no other questions, feel free to unmute, put in the
Christy,
chat.
Christy
Yeah,
might
Christy,
have
do you
another.
have your hand up still? Nope. Okay.
Okay, sorry.
So we will go ahead and compile these questions. We'll send the recording out tomorrow along with these slides. And again, thank you all for joining. If you have further questions, feel free to reach out to either Elizabeth or I. But if you guys
Best
don't have
of
anything
luck
else,
going after a new Access Point grant. And if you get funded, we would love to hear from you, just so we could say we had a little piece in that, because we wish you the best of luck in attaining this to help your community.
absolutely. Well, thank you all and have a great rest of your day.